first speaker tonight, Dr. Eddie, consultant pediatrician and a practitioner of lifestyle medicine, KL Selangor TIMA coordinator, for his presentation. Dr. Eddie.
To all the healthcare professionals and all the brother and sister, today I'm very honored to able to share with all of you about, is it possible to regain some health and vitality in 21 days? So we also know that Malaysia is really boleh when we have all type of delicious food, but at the same time, we need to pay some price. What is the price? We have roughly 50% of our Malaysians are overweight, 40% is high cholesterol, 30% hypertension, and 20% diabetes. Easy to remember, 5, 4, 3, 2, okay? And most 50% die per day because of heart disease, okay? Become one of the leading cause of death in Malaysia. And with a COVID-19 pandemic coming, make things worse. 89% of the COVID death reported to have at least one underlying health conditions, especially high blood pressure and diabetes. Okay? recently did a study. They found that if you have hypertension, if you get COVID-19 positive, there's 95% chance you may admit to ICU. So chronic disease is a great concern and high risk factor for COVID mortality. So kita jaga kita. Only we can help ourselves. But how do we help ourselves? Okay, of course, besides all the safety precautions we are doing, vaccination, one of the critical factors is lifestyle and food. Lifestyle and food. Okay. The problem is healthy meal on the market, many healthy meal on the markets, but does it really work? Everybody say my meal is a healthy meal. Okay. How do we prove it? How do you prove by science? Okay, so we look around, we found that the healthy meal must be easy to understand and easy to prepare. Not only that, suitable for most people, and very important in terms of chronic illness, it helps to prevent, help to manage or control your chronic problem, especially all the four high, all this obesity, overweight, hypertension, cholesterol, etc. And even is it possible to reverse it? Okay, a healthy meal should be able to prevent, manage, or reverse it. Is it possible? We have searched around for years, and finally we found there's a best method. It's based on the criteria from the American College of Lifestyle Medicine, where the plate methods, half of it is filled up by fruits and vegetables, 1/4 by whole grains, and another quarters by plant protein. Okay, drink water, add herbs and spices so that to make the food taste good and nice. Okay, the question is on this we call whole food plant-based diet. Okay, we have found around is it evidence proof whole food plant-based diet. Now they found out that they can reduce heart disease risk by 40%. Okay, and help those type 2 diabetes lose weight, lower cholesterol, improve glucose control. Okay. But the challenges come. What's the challenge? First, people say, I do not know how to cook plant-based diet. I know it's good, but I do not know what to do. Or no time to cook. We professionals very busy, always on call, day and out working. Okay, no time to cook, always eat food from outside, order food from outside. Okay? With this in mind, we started a program called the 21 Healthy Challenge. This 21 days healthy challenge, what we do is we use food to manage your chronic illness, lifestyle illness, to regain your health. And second, the food will be delivered to your office or home. And third, you can even do a blood test to understand your health before or after the food. So we form a team, okay? We look around with volunteer doctors, dietitian, nutritionists. We approach some restaurant, okay? We get a restaurant to cook a plant-based food based on our criteria, okay? And then we do a food menu assessment to see how's the taste, whether nutritionist is adequate. After that, everything's okay. then we start to promote the 21-day challenge to many different communities. Okay, so far more than 1,000 people have participated. We have a very remarkable result. Okay, participants just need to pay the restaurant directly to get the meals delivered. So we are not charging any fees at all. Okay, you just need to pay to the restaurant directly. So the 21 days is motivation and education. Why? Not only you're eating the meals, you are going to get a healthy diet information. We get a lot of nutritional information. We also will share with you how to handle your breakfast and your afternoon tea. Okay. Of course, if you have any questions, we can answer you. We have nutritionists, we are professional, we can answer, but many are professional. We can discuss together and share to each other. Okay. Of course, we encourage each other. Okay. Don't stop the 21 days, keep going. Okay. And we may have an online gathering, then we can gather together, then we can share information and answer some of the questions. Okay. So after that, day 14 to day 19, okay, they can have option to do the blood test, okay, on the day 14 to day 19 and see how is their improvement. Okay, even though it's 21 days challenge, but by 2 weeks, you should be able to see the good effect of it. Okay, we have more than 1,000 participants. Okay, this is a previous study where we have collected 497 participant blood tests. We found that weight, okay, roughly in 21 days, they drop about 2 kilograms. Okay, if you see the last two columns, 73% of the participant reduced weight and 26% even drop from overweight to normal weight. Cholesterol reduced 25%, 98% of the participants show drop in cholesterol, and 83% of the participants even show cholesterol back to normal level. Same like LDL, bad cholesterol, triglyceride, we have good result, more than 90% improvement, and more than 60% you show back to normal level. So in terms of pre-hypertension, hypertension, all is good result. Okay, even hypertension about 74% start to show it reduced in blood pressure, and 56% of the participant back to normal, more than safe, means no hypertension in 21 days. Okay. Same like pre-diabetic, diabetic, etc. Okay, we also show very good improvement. Even blood sugar, we drop up about 29% of the blood sugar. This is a good result. Okay, as a healthcare professional, many of us sometimes don't even able to witness this type of changes or so-called miracle, but it's not a miracle. Actually, it's a truth yet to be discovered by people. Okay, so just show you some example. We have a participant who are diabetic on diabetic drugs with blood sugar still 7.1, still high after 21 days, drop to 4.8. Okay, we have participants who are diabetes on insulin injection, also can show improvement and able to reduce the insulin dosage in 21 days. Okay. Hypertension 150/90, it dropped to 112/72. We have triglyceride level 6.18 to 3.18. And recently we have a case, our participant from Taiwan, okay, do a blood test, 13.5 triglyceride and drop to normal 1.05. You can see the blood serum, cloudy, like oily serum, okay. And after 21 days, you can see clear and can see the words behind the label, behind the test tube, you can see the words there. Okay. So we have cases like high cholesterol for years. Okay, Mr. Tan have high cholesterol from on medication for 13 years, even dropped to normal. Okay, he have coronary artery disease, high cholesterol, high triglyceride, overweight. Okay, and after a few months later, he has been taking 4 medications for past 13 years. And recent cardiologist said, you can stop 3 medicine. Of course, he's very happy. Right? We also have weight reductions, average drop about 2 to 3 kg. Okay, but this lady a bit lucky. Okay, still a healthy drop of weight, reduced 6.5 kg. Okay, Mr. Wong, he's one of our participants, 45 years old. He has obesity, hypertension, diabetes, high cholesterol, heart disease, on 7 types of medications. His wife is very, very worried. No, I think his wife kept on saying, I don't know what to do. Okay, And then after started on a plant-based diet, okay, this I think more than 6 months, he's able to reduce about 15 kilogram, and 7 medicine now reduced to 4 medicine, okay, from 93 kg to 78 kg. No fasting, just on whole food plant-based diet, and just eat and eat and eat. You can still show the result without worry about calorie, without worry about the number of amount of diet they're eating, as long as eating the correct diet. A daughter also overweight because maybe a family is the same food, so they join the program together, and the weight also improve. And this really shows that your health because sometimes we have lots of money and eventually analyze the data. Okay, when we start the first batch of this 21-day challenge, she don't believe it worked actually, but friendship, she helped me to analyze data, and she said, I've been practicing medicine for 20 years. It's the first time I've ever witnessed the great improvement in 21 days. Not just one parameter, but all the parameters. Okay? So this 21 days healthy challenge program is used to promote community healthcare, okay, to promote the healthcare to the public members. So TIMA, we organize the program as a non-profit basis. We are not collecting any fees or commission at all. Register now, don't hesitate.